Hello, I'm Dr. Christine Frissora. I'm a gastroenterologist at the Weill Cornell Medical Center in New York. As a gastroenterologist, many patients see me for diarrhea. Sometimes they have been seen by other doctors, but they just can't figure out what's triggering the diarrhea. So some common causes of diarrhea, number one, are supplements and vitamins the patients are taking. They may be taking magnesium, which could be in their calcium supplement, and they might not even be aware of it. So when a patient comes in, I ask what supplements they're taking. If they're taking calcium, I ask them if there's magnesium in the calcium. And they don't know sometimes. So the best is if they can bring their bottles of what they're taking in so I can look at the ingredients. Magnesium, vitamin C, zinc can all cause diarrhea. Many patients are taking antioxidants, especially now, and antioxidants can cause diarrhea. So be sure you understand what supplements the patients are taking. Number two, medications. Medications can cause diarrhea. The proton pump inhibitors, their number one side effect is diarrhea. Lansoprazole, omeprazole, esomeprazole, rabeprazole, they can all cause diarrhea. Many patients are taking proton pump inhibitors over the counter or prescription. When you stop the PPI, you have to give it at least 10 days for the diarrhea to resolve. ARBs, angiotensin-renin blockers, can cause diarrhea. Losartan and drugs like losartan can cause a celiac-like illness. So if a patient changes the blood pressure medication and they get diarrhea, look and see if it's an ARB. If the patient does have diarrhea from the ARB, ask their cardiologist or internist to help you change to something that does not cause diarrhea. Antidepressants can cause diarrhea, such as Zoloft. Other antidepressants, such as the SNRIs, Effexor and Remeron, normally are constipated, but sometimes they can cause microscopic colitis. So if you have a patient on an antidepressant that normally is constipating, think about microscopic colitis and get the biopsies to see. Other things that can cause diarrhea are celiac disease. Celiac disease, even if the patient is gluten-free, could be associated with lymphocytic colitis. So that's another thing. When you do your colonoscopy, make sure you get the biopsies to look for lymphocytic and microscopic colitis. We are seeing more C. diff now. C. diff can be caused by antibiotics, from exposure, from being in the hospital, or even sometimes from takeout food and from the deli counters. So if the patient is having diarrhea, be sure to check for the C. diff. If they've been having well water, the oviparasites, blastocystis, and Giardia also have to be considered, especially if the patient has been swimming in a lake, especially a dirty pond lake. Check for the Giardia. Cancers can cause diarrhea, not just pancreatic and colon cancer, but other cancers can have a paraneoplastic syndrome causing diarrhea. So we have everything from drugs and supplements to natural diseases such as celiac disease, to side effects of drugs, to cancers causing diarrhea. So it's a big gamut, but be sure you understand what the patients are taking in terms of supplements, medications, and what their medical history is, especially in terms of hypertension medicines, and any cancers they have. Thank you.